Jesse is one of the leaders, for me at least, in qualitative and coincidence analysis. I was at a meeting with her in Chicago last year, but I didn't know at that time that she was a social worker, and I am well, that she got you got your PhD in social work, right?
Correct. Yeah.
Yeah. And that I know that social work is near and dear to many of the members of our group. I'm going to basically turn it over at this point to Jessie for her to take it away.
Thank you so much, Loretta, and thank you so much for inviting me to present today. I love talking about this stuff. I'm currently, I live in Ann Arbor, Michigan, but I work for the Center for Health Equity Research and Promotion out of the Pittsburgh VA as a early career research investigator. And yeah, I mean, I can't wait to share about coincidence analysis today. Sorry, I'm trying to navigate with all the screens. Okay, here we go. I just have to say this because I work for the federal government. These opinions are of my own and not of theirs. And then I want to say a huge thank you to Dr. Kelly Coates because she shared some of her slides and I love them so much. She let me borrow them. So especially the cookie example, those are her slides. I'm just going to go over a brief personal introduction and then talk about what configurational comparative methods are as a whole, and then dive into coincidence analysis, and then how it can be used specifically with qualitative data. Then I have a little note on some main takeaways. I have some resources for where you can learn more, and then I hope to open it up for questions and comments. Since this is such a small group, I really love discussion, so feel free to interrupt me. I will say I am bad at Zoom with the managing a chat so I can't, if you're like, I have a question. So either Loretta, if you can let me know if someone's doing that, or just shout it out and interrupt me. So, but I'm bad at managing both. So I'm not
Okay.
Yes.
So I will manage the chat. And
Okay.
If you can raise your hand, because I won't see everybody on the list. So be patient with me, but I will monitor the chat and the raised hands.
Right. So brief personal introduction. I'm a partner to Navy veteran and a mom of soon to be two. I'm a mental health clinician, and I'm a health research scientist at the Center for Health Equity Research and Promotion at the Pittsburgh VA. My work focuses a lot on military families, health equity for families who cope with high stress and mental illness. And then I also do a lot of implementation science, including using these methods in implementation science. So I want to first start out with an overview of what configurational comparative methods are. And as a whole, they're just a fundamentally different approach. And don't worry, I'm going to get into coincidence analysis and how it ties into it. But configurational comparative methods, I like to say thinking configurationally versus thinking correlationally, which is I feel like how a lot of us are trained to think. It's a different approach from qualitative and quantitative, traditional quantitative methods. It has different analytical goals. There's different jargon. I'm going to get into some of that today. And it uses different types of data, which again, I'm going to show you many examples today. And my hope for you today is that you have a small taste of like down the line, someone mentions configurational comparative methods or qualitative comparative analysis or coincidence analysis. And you're like, oh yeah, I remember that one time that girl was talking in that talk about it. And I think I kind of get it. Like, you have like a recollection of it. So configurational comparative methods is an umbrella term. It incorporates a lot of different analytical techniques. You may have heard qualitative comparative analysis, which is QCA. Coincidence analysis is what I'm going to be specifically talking about. I'm not going to go into the differences of all these today. I'm just going to focus on coincidence analysis. Logic regression, not to be confused with logistic regression. I did that at first. Is another form of CCMs, and then matrix multiple case study approach is another form.
I would add in that coincidence analysis is sometimes known as CNA, so that people know the both.
Yes. But as a whole, CCMs are a case-based approach. It answers complex questions where context matters, right? So in my field of implementation science, context matters like a lot, right? Because you're trying to implement a program. And what are the variables that make it not work is the context. So what strategies work best in which setting to lead to a desired outcome? What are the difference makers that lead to the desired outcome? It can be used with both quantitative and quantitative data sources. It's systematically coded and calibrated. I'll get into that a little bit today, primarily just with qualitative data. And then after solutions are created, you can go back to the cases and the quantitative and qualitative data for more in-depth exploration of solutions terms in the model. And I have an example of this. So if you're like, I don't know what that means, just hold tight. It's a systematic mathematical approach. So there's a comparison of cases to identify combinations of conditions that make a difference for an outcome. It links the individual cases. It links to the individual cases that persist throughout the analysis. You can have a range of sample sizes, so which is why a lot of people sometimes come to this method, because you can have like as low as like a sample size of 7 or something, or you can have as large as hundreds or thousands. It allows for exploration of complex phenomenon to assess solution terms in the context of specific cases. And you're like, well, what's a case? Cases can have a lot of different defining characteristics. It could be individuals, it could be institutions or organizations, it could be regional entities such as countries, states, or counties. So what is coincidence analysis? And that's what I'm really going to be focusing on today, known as CNA. So, as I just mentioned, it's a cross-case method. It's newer to the CCM family because it uses this bottom-up mathematical approach. It is an inductive method. And how does it do what it does? It uses Boolean algebra. So for those of you that are like, Boolean what? I don't know what that is. I guarantee everybody on this call knows what Boolean algebra is and has used it, because if you've ever done a Google search term or a lit review, you've done a Boolean logic term. If you're like implementation science and consolidated framework for implementation research, or quantitative data or something like that, that's a Boolean logic statement, the use of ands and ors. It operates in the regularity theory of causality. So causes are regularly followed by their effect. So whenever the cause occurs, so does the effect. And it explains this with necessary and sufficient conditions. I'm going to explain that in just a little bit more. It allows for causal complexity. So things combine in unique ways. So for example, if you're looking at, factors, like for implementation science, you can say it matters. I'm going to get into more of these later, but like you have to have a champion and you have to have supportive leadership in order to have successful implementation of your desired outcome. You have to have both of those things present, not just one or the other. It allows for equifinality. So where there's more than one, road that leads to Rome. I kind of like people to think about that. So you could have multiple successful pathways to get to your outcome. It's not just one thing. And then it allows for, this is specifically for CNA, sequentiality, so causal chains. And I'm going to go into this article here in a little bit in depth, so you're actually going to be able to visually see what I mean. But what I mean by causal chains is A happens, then B, then C. So it's not A, then C. It has to be A, B, then C. So it has to go in that chain, in that order. So I'm going to get into some examples of what coincidence analysis is, just as a higher level, so we can all kind of wrap our heads around it and get on the same page. So again, I'm trying to get you to think configurationally, trying to leave behind that correlational thinking. So we all know how a fire is made. You need heat, you need fuel, and you need water. This produces a fire. If you have just one of these things, you're not going to get a fire. You need all three of these things at the same time happening in order to get a fire. Like I just said, if you just have heat or oxygen, you're not going to get that fire. So that's like kind of that causal complexity. Now I want to use I'm going to use this cookie example. So there's a lot of ways and a lot of recipes for a cookie, right? So, and there's ingredients that I feel like we could probably have a debate about, but we won't. Like what's the best cookie, right? What is the thing that makes the best cookie? Because as researchers, we often want to know what's the best way to do something, or what's like the thing that's going to make the difference, right, for our outcome. But for this context, I just want you to think about cookie recipes. So first we need to determine an outcome. What makes a good cookie? Is it tastiness? Is it the texture? Is it the size? Is it the color? There's a lot of ways. There's a lot of things. There's a lot of outcomes, right, to a cookie that we have to think about. And we have to think about what we want our outcome to be. And then we have to think about, well, what are the factors we want to select? Like, what are the factors that matter most for, let's pick tastiness. Like, right, that's like a darn good cookie. It tastes so good. So we don't care how it looks. We don't care about the size. We want tastiness. We have to think about, well, what's our framework, right, for deciding what determines tastiness? Is it the butter ratio? Is it the sugar? Is it the temperature of which it's cooked? Another interesting thing about CNA is it allows us to do this from a configurational way through what's called a minimally sufficient condition function in R. We're able to systematically select factors for our final model. And then, as I was mentioning, when you're deciding what factors matter most for that tastiness, we just decided that tastiness is our outcome for a cookie. We have to calibrate our factors. So is it nuts versus no nuts? Or is it low nuts versus medium nuts versus high nuts? Like, so we can have all these different, calibrations of factors that we have to decide before we even get to any analysis, right? And then this is an iterative process. So some conditions also need to occur together in order for the outcome to be achieved. We have to have nuts and chocolate. We can't just have nuts. We have to have both in order to get that desired tastiness. And understanding that to achieve a not amazing cookie does not mean that the exact opposite needs to be true of what makes an amazing cookie. So just like because you have like nuts and chocolate, and I'm making all this up, cinnamon and all these things, doesn't mean that, let's say we find that that's what makes a tasty cookie. When you don't have those things, it doesn't mean you don't have a tasty cookie. That's like kind of the logic of CNA. So I want to go through some fundamental assumptions and definitions before we continue with this cookie example. So hang with me. So I mentioned equifinality, before. So more than one set of conditions can lead to an outcome, right? There's more than one pathway. And you use this with the use of the word, when I explain more in the examples, the use of the word or the symbol plus, just to show different pathways. And again, there's like causal complexity, again, allow for multiple conditions to be present together for the outcome to be present. When you see this, you're going to see the use of the word and, or like that multiplication star symbol. So again, we're going to get to that in a minute. So you have equifinality, multiple pathways. That's that or, that Boolean logic or plus sign. Or you have this causal complexity with an and, meaning things have to be together, or that star. And then there's asymmetry. So although the presence of a factor produces the outcome, its absence may not lead to the non-occurrence of an outcome. An occurrence and non-occurrence of an outcome are a distinct phenomena. So a negative model is not nearly the negation of the positive model. So you can't assume when you see things in capitals, that means the presence of A, B, and C. Sorry, A or B or C leads to D is not A or not B, not C leads to not D. If that makes sense.
Something for the group. We sent out the Rattray article yesterday, I believe, and that is a good example of what Jesse's talking about right now, of looking at the outcome and looking separately at the not outcome. It's a nice example.
And I'm actually going to dive deeply into that article as an
Good.
example after the cookies. So, but I want to try and orient you. So thank you so much, Linda, for pointing that out, um, to what, to how to look at it first. So with cookies. So some terminology that's used in CCMs and in CNA. So this is again for both, that umbrella, are conditions. I've been saying this already. These are factor values that are hypothesized to be causally linked to an outcome of value. Difference making, so it encompasses both necessary and sufficient conditions for an outcome. Necessity, so that I just use the term necessary. Whenever the outcome is present, the condition is also present. So the calibrated factor is also present. Sufficiency, whenever the condition is present, the outcome is also present. And remember how we were talking about what makes a good cookie? We've decided on tastiness. That's our outcome. And then these are two measures of fit for CCMs and then also for CNA: consistency and coverage threshold. They help you understand the strength of a relationship. So consistency are the cases with an outcome present and covered by a solution divided by the cases covered by the model solution. And then coverage are cases with the outcome present and covered by the solution divided by the cases with the outcome present. So I'm a visual person, so I wanted to kind of give you a visual for how to see this. So when I think of consistency, I'm like, how consistently am I seeing this pattern in my sample? So these are each of these circles. Can you see my mouse if I do this?
Yes.
Okay, each of these circles are different samples, and you can think about, okay, so in this sample, I see this pattern in 100% of my cases. I see it everywhere. This one, I see it in about half of my cases, and this one, I see it in about 75% of my cases. And this is the solution, right, that you would see. Coverage, I like to think about how well does my solution cover and explain my outcome. So this circle is the sample. The outcome is present, again, let's just say about 75% of your sample. And then my solution would have about, I don't know, 65% coverage. I'm making, this up, but that's what I like to think about. How consistently am I seeing this pattern? How well does this pattern cover my outcome? So back to the cookies. So what are the difference makers in a darn good cookie? So again, through this iterative factor selection process and the iterative calibration process, we decided to include the following factors: butter to sugar ratio. So 0 is not 1-to-1 ratio. A 1 is a 1-to-1 ratio. We decided on oven temperature. You can see here like what the temperatures are for 1, 2, and 3. This is multi-value CNA. We decided on altitude, and we decided if it was made with love or not. We also determined criteria by which makes a darn good cookie. So 0 was not a darn good cookie, and 1 is a darn good cookie. And we decided on tastiness. So these are pathways to a perfect cookie. So this is like we run this analysis. So if you want to see, I wanted to show you here, this is actually like an example of data set. So these are the cases. We had 20 cookies, right? Out of 20 cookies, this is our outcome. Not all of them were darn good cookies. And then these are the factors based on that iterative process out of all the potential things that could make a darn good cookie we decided on. And then these are the respective scores for each cookie: their temperature, their butter to sugar ratio, the altitude, and the made with love. So when we oh, yeah?
I have a question, Jessie.
Yeah.
For the outcome, does one need to have differences in outcomes? In other words, here you've got not good cookies and darn good cookies.
Yep.
There must always be a difference.
Correct. Well, in order to get like what I was saying, like I've been using the term difference maker, I want to know what makes a difference for my outcome. That is what I want to be able to say as a researcher. I have to have some examples of when there wasn't a good outcome, right? Or my outcome wasn't there. Otherwise, I won't know what made the difference to having it be there, if that makes sense.
Absolutely. No, because I was looking at doing something with coincidence analysis in some medical examiner data. They're all dead. And we concluded ultimately it can't be done.
Could you look at, well, we can talk about this later, but
Yeah.
cause of death, which I would assume would be different. Um, so there are different ways to, think about things. Um, let's say that this is the model we get. So again, so the temperature has to be at the score of 2, the butter to sugar ratio, it has to be 1 to 1, the altitude has to be 1, and it has to be made with love. That's what makes a darn good cookie. This is the way to do it. Sorry, I think I read it wrong. Um, this is a conjunct, so these two are present. They have to be combined together. You have to have this oven temperature and this butter to sugar ratio. And then this is or. So these are the different pathways. Or you can have lower altitude combined with that love equals a darn good cookie. So there's 2 pathways we're looking for. Of the 20 cookie recipes, there are 15 that give us a darn good cookie. Of the 20 cookie recipes, 6 of them have this conjunct, butter, sugar ratio, and temperature. And then of the 20 cookies recipes, 7 have that combination of altitude and love. So we're going back to the cases. So remember how I said this is a case-based approach. So I really want you to think, oh, I can just like go back to my cases and have this explain my pathway, my solution, my outcome. Yes. So again, of the 20 cookies, there are 15 recipes that gave us a darn good cookie. These are highlighted in blue right here. Of the 20 cookie recipe, 6 of them have the temperature and that butter to sugar ratio. So if you see here, this is what we call a conjunct. They are together.
We're not seeing your pointer.
Sorry, thank you. I was on the wrong screen. Okay, so if you see me look up, I'm looking at the here. So these are the outcomes here. So if you see, these are the 15 recipes with a darn good cookie. This is the temperature to butter to sugar ratio. See, these are what we call conjuncts. They have to be present together. When they are, they're leading to our outcome. And then of the 20 cookie recipes, 7 have this altitude and love, right? So that's right here. These are another set of conjuncts. This is one pathway, and this is one pathway to lead to a darn good cookie. So another way we can do this is, again, looking at consistency and coverage. So remember those consistency and coverage metrics I was saying? So that was like a visual way to look at it. You see that you have a high consistency score and a coverage score, and you can see the individual, this is like of the overall model, again, with 2 pathways and 2 conjuncts. And then this is the individual consistency and coverage score for that one pathway of the temperature and butter to sugar ratio, and then the altitude and the love. So where do we go from here?
Oh, can you say something about kind of what is an acceptable consistency and coverage rate?
Yes. So there's a debate in the field about this. So we don't have like a standard. I can't just say, with p-value, I try not to compare with a correlational methods, but like we can't say 0.05, right? We have that general sense of a cutoff, but when you're doing factor selection, right? So when we had all these variables back to the beginning of like, is it like that could matter for a darn good cookie? We have a consistency score of 0.75 and a coverage score of 0.25. So that's for the selection process. And if it's below that, you're basically like, this isn't going to matter. This isn't going to matter for a final model, so I'm not going to move forward with it, right? In my final modeling process. And then for overall models, it's different in the fields, like for different methods, but for specifically coincidence analysis, you would see something like, 80 to 70. Consistency could be like around 75 or 70. And then coverage could be as low as, 50, but you want them kind of higher, and then you'd want to explain why the coverage is so low. You know what I mean? You'd have to explain the numbers. So that's why there's no standard way, because like if you have really messy and noisy data, you're not going to have as high consistency and coverage. And there's also a problem, I don't want to get on a tangent, but overfitting the data, right, with a pathway or a solution. So, you could have perfect consistency and coverage, but then you'd want to be like, I'm not sure, you know what I mean? It could leave a reviewer being like, is this overfitting? Is there model ambiguity? So I don't get into those things in this presentation, but if you want to learn more, I'm going to give you tons of resources to learn more if you want to know what those things mean. So, great question. Any other ones? Okay.
If you
I
don't want to
actually
raise
have-
your hand, just put
Oh,
something.
sorry. I can't. Yeah, just chime in, start talking.
No, I'm to the group. If you don't want to raise your hand, you can put something in the chat. I will see your hand or what you put in the chat.
I don't have the hand rise, like I can't find the icon now. Can I just chime in really quickly?
Yes.
Okay, so just can you just um explain, maybe you've already said it, like how many cases do you have to have as a minimum to sort of like look at that
There,
method? Like how
yeah.
many cookie recipes or whatever?
Yeah, no. That's a great question. So, and it's similar to my answer to Loretta's. There's not like a set rule, right? So, and what's cool, the reason why there isn't is because we're thinking configurationally, not correlationally. We're not bounded by net effects, right? Where we have to have an N, which needs, allows us to say with certainty, right? This is what the effect we're seeing. So because we're using a case-based approach and we're thinking configurationally, I mean, you could have as little as like 7 cases, 5 cases. You want to, again, like going back to Loretta's question, you want to have some difference between your outcome, right? So you have to have some cases where there's no outcome, some cases where there is an outcome. The more cases you have, the more that you can say, this really seems to be a difference, right? But this is also one of the reasons why it's used so much in implementation science, is because a lot of times you don't have a lot of sites, right? You have 5 or 7 or 10 sites, so, and you can, but it's hard to get a site. It's a whole hospital system. So, that's why I think it's also a popular method in implementation science, because it assesses context and it can be used well with low ends.
The corollary to Julia's question would be, is there instances where you can have too many cases?
Too much heterogeneity, or not too many cases? I don't know. I don't know of an instance where there's too many cases. I mean, you just have to have a really good computer, because your computer could crash.
Yeah.
The more cases you have, the more factors you have, because it's going to run all the possibilities, right? So, those are the only considerations you have to think about. And with this MSC function, it's really nice. So, and then in QCA, there's this like ratio of like, cases to how many factors you can have, right? And we don't have that in CNA. You could have more factors than you do cases. Not like an insane amount, but there's been published papers and stuff. You can have more factors when you start out with more factors than there are cases, and you narrow them down using this technique called minimally sufficient conditions. So the other thing about this, so this is the last thing, and then I'm going to jump into some applied examples, right? Some applied research examples is you can make analytical decisions based on your findings. Like, do you feel like enough can be said about a darn good cookie based on the model? Like, or do you feel as your researcher, the person who's involved with collecting these interviews or collecting the data, like, do these models make sense? Like, you always want to have a theoretical framework that you're working with, that you base, your factor selection off of. You're not just like going in the dark, and you go back to the theory. Does this make sense with what the theory is saying? Do we go back and get more cases for better representation of a not good cookie in the sample, being like, okay, this is 20. I think I want more, let's get another 10 or another 20. And then do we look to other factors that might be at play for other cases? So one of the things I wanted to highlight, so look at cases 3 through 20. These are darn good cookies, and the solutions, the 2 pathways we found, aren't in them. So are we missing something? Are we missing something by not describing these cases? Remember, we didn't have perfect consistency in coverage. So this is what's cool about this case-based approach, is after you get a solution, you can go back and ask questions, finalize, retweak, and whatnot. So now I'm gonna have to focus, that was to try and get you to think configurationally. Now I want to do some applied examples. Oh, I see someone raised their hand. Yeah, Nadir.
Hey, thank you so much, Dr. Dodge. This is really helpful. My question is regarding how to present CNAs and kind of configurational thinking, specifically around the question of causation versus association with individuals who are less familiar with CCMs in like grant applications or in research proposals, because I think especially words like difference making can sometimes trigger people who are like, very focused on the causality versus associative nature of things you're looking for.
I don't have any examples like for theoretical. So in here, but the biggest thing is Venn diagrams, like where you're talking like theoretical, like when you have, and a lot of conceptual frameworks already have these built in, like things like intersecting and leading and or overlapping with each other, being like, how do we assess this? We can't do this correlationally. We have to do this configurationally. It's things combining, leading to other things. So and it's not just one way. I'm going to get into some examples to show results. So you could show an example of a previously published paper and the results and how they're thinking about things. But if you're purely talking like a grant application, trying to justify it, you can include, I like Venn diagrams to visually show that relationship. Or if you have a theoretical framework, like I know social determinants of health or the consolidated framework for implementation research, it's already designed in a circle, and so you don't have to do anything. You just put, one of the, frameworks in there and be like, we need configurational thinking to assess this.
Cool, thank you.
Yeah. Great questions. So for the next half of this, part of this, I'm just going to really be focusing on qualitative data. This can be done with quantitative data, but because this group is all qualitative, that's why I'm focusing on qualitative. How to use CNA with qualitative data. So this was the Rattray article that I sent out. Thank you, Loretta. I'm going to kind of go through it in examples. I really like how this is in the Journal of Mixed Methods. They do a really good job of like doing a step-by-step process of like kind of like how to do this, like combine these two methods in a systematic way. So for those of you on this call, you're probably familiar with this upper half, but then this is where CNA comes in. So I just want to highlight, if you already have an existing qualitative project on or going on or completed, and you maybe have some lingering questions, I'll get into what questions could be good for CNA. You can still do this part. You can still do the second half part and use CNA with your existing qualitative data. And this initial project, which I'm going to dive into in a little bit, it didn't have CNA in the mindset, like from the get-go. So it was something they added on after the fact. This is another paper I'm going to dive into in a little bit. Again, you're probably familiar. Okay, they did inductive coding, they did deductive coding and analysis, and then they did verification and extended analyses, and then they did CNA. So again, it wasn't initially designed to have CNA in it, but one of the reasons, and I'll get into this more, was they just had this lingering question of, I feel like these two things are happening at the same time, but I can't prove that with themes, and grounded theory. I want a systematic way to show that, these things are happening at the same time and leading to this outcome. So I'm going to get into some examples now. So example one is pairing CNA with qualitative methods to model veteran community reintegration outcomes among U.S. military veterans. I feel like when I was just starting out with CNA and thinking about qualitative data, I was like, how does this even work? Like, this doesn't even make sense. How am I supposed to get my words to be numbers? Like, this is weird. So again, this article does a really good job of showing that. So this is cultural, right? So this is a very qualitative code, right? Very thing. They have a description. So for this one, refers to both values, beliefs, and motives among participants, as well as conflicts with civilian cultural practices. So this is that, again, cultural shift from being active duty to civilian. Then they had parameters where they define what each of these numbers meant numerically. So, and they defined it qualitatively. So +2 is prefer civilians over interactions with veterans or is well adjusted. +1 is able to cope with civilian interactions or talks about it in passing. 0 is no mention or about no mention or absence. The negative is annoyance or periodic discord with civilians. -2 is significant issues, persistent unease, or feeling of being detached. And then they even had representative quotes for what each of these numerical values meant. So for a +2, a veteran could say, like, I felt isolated, or I don't like, or I don't belong with anyone like that. Yeah, that's nothing. There's nothing there. And then the -2 is feeling like you belong in a civilian society. No, I don't. I don't belong in a civilian society. I belong in a military society. So, and so you can really do a good job. I think I really like how they outline how they calibrated their qualitative data in preparation for CNA. So I'm going to now get into what they found, right? Their outcomes. So this is a positive model for veteran community reintegration for what leads to a positive community reintegration for a veteran. That was their question. They found 3 pathways. One was a high score for life purpose. Another was a positive score for military experience. So I'm going to use my cursor now. You see this life purpose. You see military experience right here. And then you see a positive score for cultural adjustment right here. And you see these cases down here, so this outcome right here is positive community reintegration. This is not positive community reintegration. And then these cases right here, this would lead to not a perfect consistency score, right? We're not consistently seeing this pattern in the presence of our outcome. And then this is what the table would look like. So this is another thing, Nadir, that if you wanted to show examples, this is what a table this is called a 7 C's table. So you can look at, so this is what they found. They found social support, life purpose, military experience, cultural adjustment. These are conjuncts, right? There's being together. So you need a positive social support score or a strong positive life purpose score combined. That's one pathway. Another pathway is a positive social support score or a positive military experience. That's another pathway. Then another pathway is a positive social support score or a positive cultural adjustment score. Each of these pathways is a way that a veteran could experience a positive community reintegration, right? It's not all one thing. And these things have to happen together in order for a veteran to experience that. For an overall, you'd see the consistency and coverage scores. They're not perfect, but they're high. So now, remember, as I mentioned, one of the assumptions with CNA, just because the presence is there for the outcome, it doesn't mean its absence is there for the not outcome. So for the negative model for veteran community reintegration, you'll see negative score for military experience right here, -2. You'll see a -2 score for military transition combined with a -2 score for cultural adjustment. These are conjuncts right here. And then you'll see a -2 score for social support and a -2 score for life purpose. So some of them are there, right? So if you see here, life purpose had to be strong positive for them to be a good positive cultural experience or a positive transition. And then here it's negative for it to be a -1. Sometimes it happens like that, but it doesn't mean that. And then this is the overall solution summary for this pathway for the absence or for a negative reintegration experience. Again, you'll see some conjuncts here and then also some single, like just positive, sorry, just really I'm gonna sneeze. No, I'm not. Really negative social support by itself or really negative life purpose. But then you'll see negative military experience combined with negative military transition or negative military transition combined with negative cultural adjustment. Those two conjuncts are their own paths that lead to a negative reintegration experience. The other cool thing that this article does is knowing that these, again, they did a whole factor selection process that they explain. I didn't go into depth into that in this example because I want to show you some other examples. These are the factors that they chose for their model. you can do case summaries, which is so cool. So like this is, they highlighted one case. Again, the whole point of this method is a case-based approach. You're going back to your cases, back to your data. So they did a summary. So this is a combat veteran, 50% disability rating, mental health and injuries included multiple concussions from deployment, substantial anger issues, and ongoing challenges with social interactions. They have like a representative quotation here. And then they also have like kind of a meta inference. So although this Marine had a positive military experience and prioritizes his family, he feels stressed to provide financially. He had a high negative discharge and struggles with strong ambivalence about interacting with civilians at work and school. So these are, again, examples of unsuccessful reintegration. So this is something, again, you can do with your existing qualitative data and take it a step further. So this is another example, and this is with genetics. You all are probably more well-versed in genetics than I am. So if I get some of it wrong, please forgive me, but I'm going to try and keep it high level and based on the methods for this. So this example investigated cancer risk management decisions among females with pathogenic or likely pathogenic variants. I'm not going to name those. To understand why some patients follow the National Comprehensive Cancer Network guidelines, whereas others do not. So in other words, this researcher, Debbie Cragen, she was seeing a lot as a genetic counselor. These women were getting specifically hysterectomies and mastectomies when they got these genetic scores. You probably all know about or aware of like the BRCA gene, and if you have that gene, you have a 70% chance likelihood of getting breast, ovarian, or ovarian cancer. So women were taking, these are not minimal surgeries. They're not non-invasive. They're very invasive. If you get a hysterectomy, you go into early menopause, which is a huge transition. And women were getting them and they didn't need it. It wasn't in the guidelines. Like, why are these women getting these procedures? So she did qualitative interviews and again, wasn't going to do coincidence analysis to begin with. And she was seeing some patterns that she felt like she couldn't explain with standard qualitative methods. And so she's like, I gotta do coincidence analysis. So what she found was there were 3 participants who underwent guideline inconsistent prophylactic surgery. 12 fit one of 3 unique patterns. So one is a cancer-related anxiety in the absence of trust and care. So I'm going to use my cursor here. So if you see cancer-related anxiety in the absence of trust and care. So if you see here, they had anxiety and they did not have trust and care, and then they underwent this unnecessary procedure. Another pathway was the provider recommended surgery inconsistent with the National Comprehensive Cancer Network guideline. You'll see, where did it go? See here, these ones right here, they recommended, and it wasn't in line with what the national recommendations are, and surgery occurring before genetic testing. And those are down here. 2 unique patterns were found among 18 of 20 participants who followed guidelines. If you see anxiety along with trust and care. So even though if they had anxiety, as long as they had trust and care, they didn't get the surgery because they trusted in their care. Or lack of anxiety and no prophylactic surgery before testing. So you'll see that, you'll see those here. And one of the things that, if you click on this article and you look into it further, Debbie Cragen, I'm trying to be mindful of time. There's one more example I want to get to. She'll talk about what was so cool is this role of anxiety. She like kept reading the interviews and understand, about anxiety and not understanding. And it was this combination of anxiety and trust and care that the coincidence analysis really helped her understand. So it was when there was a combination of trust and care and they had anxiety, they didn't get this unnecessary procedure. But when they didn't have that trust and care, they got it. They're like, I'm taking this into my own hands, which is what she felt like she was missing and couldn't put her hands on when she was just doing standard qualitative methods. So this is the final example. So this is a CNA and qualitative methods in implementation science. So for those of you, this is the CFR, so the Consolidated Framework for Implementation Research. They did 66 interviews with genetic counselors, pathologists, oncologists, administrators, and others in 19 unique universal tumor screening programs and non-programs from 9 healthcare systems, and they did CNA combined with heat mapping. And what I want to show you here is, so, you know, for those that have used the CIRA, that you code qualitatively -2 to +2. So there's a -2, -1, 0, +1, +2. And through this process, she describes it in the article. You know, she coded it so it's clearly present and positive versus not at all, right? So this is part of that calibration, that iterative process where you're preparing your data. And these are like the factors. So there's I can't read them. No, sorry, you probably can't. Maintenance champion. Let's get to the results. So here we go. So C for contracts, they said composition, peer pressure, cost concerns, inner setting, implementation champion, attitudes, knowledge, advantage, evidence, maintenance champion. So remember I was talking about those causal chains, how A has to happen, then B, then C. This is a really cool example. So they hypothesized factors that may make a difference for implementation outcomes and assigned values for each outcome. And they really felt like it was happening with these constructs. Planning and engagement was this intermediary thing that was happening before if the program was optimized. And these were tumor cancer screening programs. So this is a really, really cool figure and graphic. So if you see here, I'm going to start with the bottom. I just think it does a cool job explaining the no program implemented. So there are negative attitudes or lack of knowledge or mixed advantage that led to an absence of planning and engaging, that's what then led to no program being implemented. It wasn't just negative attitudes or lack of knowledge or mixed advantage that led to no program being implemented. It was this absence of planning. There was a step in between that was what then led to the no program being implemented. And if you see here for this outcome, these are 3 outcomes. Again, this is multi-value CNA. The non-optimized program being implemented, there's different pathways, right? So we can have mixed attitudes, but positive advantage and evidence leading to limited planning and engagement, which is not optimized. You could have a conjunct of clear evidence of an implementation champion and no evidence of a maintenance of a champion. That leads to this limited planning. And then another one is positive attitudes and positive advantage combined with a mixed inner setting. This is a direct pathway to non-optimized programs. And then for the fully optimized programs, you have positive inner setting and clear evidence of the maintenance of a champion. So this is an example where you have 3 different outcomes, different pathways within each outcome, and you can explain this. And this was with all qualitative data. So this is implementation science, CIRA interviews. So main takeaways are CNA is within a larger family of CCMs, is a fundamentally different approach. It can be used with both quantitative and qualitative data, and it can really help systematically tell complex stories with qualitative data, whereas other types of analyses may not be able to. So if you have questions, one of the things I like to highlight is just simply Google coincidence analysis. A lot of free, really great resources come up. I run a call called co-run a call called All Things Configured, where we meet every other month and we just talk about applied examples or things people are working on. You can feel free to email me. I also want to highlight this free Zotero library, and it does a really good job of listing if you're like, I really want to know how this has been done and compared with regression analyses or how this is different. Go there. It has a whole section on methods articles. So Nadir, I would recommend going to this page right here and having a plethora of resources, or citations you can cite. Another thing is, if you want to learn how to do this, there is an upcoming training in Copenhagen. I'm expecting my second baby, so I will not be there, sadly, otherwise I would be. And it's a great, I cannot speak enough. It's about the founder of the method, Michael Baumgartner. He's leading it, and there are other leaders in the field. I think Loretta's already going, so you can see Loretta in person. As you scan this QR code right here, it'll take you right to the registration. I believe it closes April 26th. So you do have some time, but it's in May. So, and a really fun, who doesn't want to go to Copenhagen? And I think that is all I have. So I will escape.
I will add one more thing, is that there's I was surprised you didn't mention is Where's Michael? What institute is he at? University.
Norway,
Yes.
is it the University of Norway and Bergen?
Bergen, it's Bergen.
Yeah.
They also have a lot of articles that are available on CNA, QCA, and examples. So I often go there, but thank you for those other two resources.
Yeah.
In addition to it, this has been wonderful, and I would love to, well, good luck with your upcoming birth.
Oh, thank you.
And I'd love to invite you back for another, presentation next year. This is great.
Yeah.
And I was going to say, we will, Jesse will be sending me the slides.
Yes.
We will have the video recording of this session. So just contact me and I'll be sure to send on the link to the session and the set of slides. So with that, I want to thank you. This was fabulous. This was really fabulous. And I want to encourage anybody to talk to me about CNA. I am very enthusiastic and see lots of benefits, as Jesse said, to the combination of this with qualitative research. We also talked a little bit, Jesse and I talked a little bit about compare and contrast what you find when you do a more regression approach to implementation, and what are the factors that result in a successful implementation. Compare and contrast that to what you find in CNA, because you're only going to kind of find one path with your regression where there may be actually multiple paths.
Well, because that net effects, that's a limitation of the net effects. I mean, it's the design, right? You want to know what's the one thing that's mattering. I mean, because a lot of times stakeholders want to know what's that one thing, and statistically, it's telling you this is the one thing that's driving your outcome the most. So you're controlling for these other things, and you're doing all these other things. But sometimes it's not one thing, and it could be multiple pathways, and it could be not just like one thing for each pathway. It could be a combination of things, right? It's the presence of a champion and the supportive leadership that's impacting your implementation. It's not just one, and it really is useful to answer these complex questions. And that's where I found it. I didn't tell that story of how I found the method, but, was to answer these complex questions, specifically around social determinants of health.
I mean, it's a particularly good marriage with implementation science, where you've got multiple institutions with lots of different things going on within the institutions. Mm-hmm. Hey, let's look at this in a more granular way.
Yeah. So, yeah.
Which is kind of a philosophy of qual research too. Look at it in a more granular way.
Yes.
Thank you so much. We're almost at the top of the hour. I really enjoyed that. I hope others got something out of this. She did a fabulous job of explaining configurational analyses. Take it from me, who I've been struggling with it for a few years now. She did a great job. Thank you so much.
Okay. Take care.
Take care, everybody. Bye.